From the South Pacific Division of Seventh-day Adventist, welcome to Mission Sunlight. When Jesus was on earth, He modeled for His followers to meet the needs of those who are in physical pain and distress. Today, Mission Sunlight travels where medical outpost and healthy living projects are reaching out in communities where there is little or no medical care, here in the Pacific Island country of Vanuatu.
These medical outposts will bring the most basic health care to the most isolated reaches on Earth, and they'll bring the story of Jesus.
Here in the South Pacific Division, we have a number of countries spread across the Pacific Islands. And in many of these countries, we operate clinics. Look, this goes back into the early history where our early pioneer missionaries trekked through the highlands, trekked along the coasts, and wherever they could, they would try and treat people with sores and disease and malaria. And out of that grew a very interesting chain of clinics. Some of these clinics became very run down, a bit neglected over the years, so we started what we called in the South Pacific Division the Adopt a Clinic program.
Involving the local church was a vibrant part of the Adopt a Clinic plan.
The local church would adopt a specific clinic that was assigned to them, so build the relationship and help wherever they could. So we prepared reports of all the condition of the clinics, and those reports went out to the churches, and the churches would adopt a clinic. They would raise funds, they would send a team, work with the local people to establish a new and better and improved service.
With success often comes the need for program expansion. That's exactly what happened in Vanuatu.
We have 6 existing clinics within the mission, so at this point in time we are upgrading these clinics in their physical structure to be representative of what we expect as Adventist health clinics. We will build clinics within the areas where they are isolated.
We have in this district about 14 organized churches and 25 companies in our district. We have about 8 ministers which are working under my supervision, and we have about 2 rural clinics operating at the moment. We have 1 junior secondary school. We have 6 primary Adventist school in this district. The total membership of this district is about 1,000 plus membership, which are Seventh-day Adventists in this district. Evangelism is one of our targets in this area. Tavia province is one of the most populated and province.
In the remote regions of Vanuatu, serious communicable diseases threaten the lives of both children and adults.
We have what we call a double disease burden scenario, where we see lots of communicable diseases like malaria, tuberculosis, pneumonia, respiratory infections, and all kinds of other infections. And also another trend of pattern of disease that we see rising in the Pacific is non-communicable disease or lifestyle diseases, mainly diabetes, high blood pressure, coronary heart disease, different forms of cancers are on the rise these days. So what we would like to see in the medical outpost is to target these double disease burden scenarios.
Nancy is one of the nurses in an outpost clinic. It just happens that the clinic is in her home village. Following retirement from working as a supervisor of rural nurses, Nancy learned that a new clinic was going to be opened in her village.
I decided and talked with director and said I'm willing to do the volunteer in this clinic while I'm waiting for a new staff to come in. So I'm still working here until now. The distance from here to the main center, it's quite far. The moms have to carry the baby and walk across the desert, which is, very hard and far. Even to go to the main hospital on the western side, it costs a lot of money.
Local residents share how grateful they are for the medical care found in the Seventh-day Adventist outposts.
The spiritual benefit here is when we are fortunate to have a nurse, an Adventist nurse, that help us spiritually and encourage and prayer when we come to here, and we find spiritual healing and physical too.
Before it was gone, we used to travel many kilometers to get health service, as far as 6 to 12 kilometers to Waichan and up to Lenagal Hospital. So with this one, it is very useful to our need to provide health service in our communities.
In terms of Western costs, the clinics are rather inexpensive to build.
Thinking US dollars, the average cost of a new clinic might only be $30,000 or $40,000. They're fairly basic. There's rooms, a number of rooms. There's rooms for examination. Some of them will have a 2 or 3 bed little ward, have a veranda outside. We try and put in solar panels to run a little refrigerator that can keep those medicines so they're usable. Placed for washing and dressing of sores and basic medical equipment. So it's not flash, but in this area, it's everything that they could ever dream of.
As the medical mission outposts expand, some members dream of the day when there can be a full-fledged Adventist hospital in Vanuatu.
One of our big vision here, if we can have a little health center or hospital run by Adventists in this district, because in this country, Vanuatu, we didn't have any mission hospital yet here. We have it previously, that was long ago, when the expatriates are here. But recently, there's no more Adventist hospital here.
The ministry already accomplished in the clinics has been because of faithful volunteers. Your fellow co-laborers in these remote fields, thank you for your support of missions.
I would like to thank you very much for your generosity in giving support to build these clinics in our district. And I pray that the Lord will continue to bless you as you continue to give to help our other rural clinics to be built as a right hand of the gospel message, to prepare our people here to meet the Lord when He comes back in the air.
We really appreciate the contribution of the World Sabbath School, and when you're sitting in your little local church, you are making a big difference in so many areas of the world, and you will make, through your offering, a very big difference in areas that need help so desperately.
Volunteers are freely giving of their time and energy to staff clinics that are a pillar of hope in their communities. The need for more medical outposts is great. The offering for 13th Sabbath is just weeks away. Have you made plans for your gift to help fund clinics that will save lives, both here and for eternity? Reporting from the island nation of Vanuatu, this is Mission Sunlight.